My name is Shauna Hudson, and I am the Director for the Community Engagement Core for NJACS. So we're really excited to have all of you together today to be talking about this project.
The way this came about was I given a talk at our GME Rutgers, I should say our BHS GME talk about social determinants of health and how important it is when we're thinking about giving care to our patients and talking about implicit bias and health inequity. And Dr. Bleich was on that call and around that in the audience, and he contacted me about his project, which is LifeMap. So Dr. Bleich has already started this LifeMap model, and the LifeMap model is a cloud-based platform, and he has been asking these questions through this LifeMap in terms of asking patients about their lifestyle and how we can look at lifestyle and how it incorporates into their diabetes care management. And one of the things that we are trying to do is really capture real-time data around social determinants of health in those individuals who are already using the LifeMap tool, because we realize that we really can't make change or affect change and optimize a patient with diabetes health unless we really look at all the different forces that come into play. So looking at social determinants of health specifically. And like we can talk all the time we want about take this medication, check your sugar this much, but if they don't have access to a car to pick up their medication, or they can afford to buy their strips to check their blood sugars, all that's out the door when we're thinking about social determinants of health and the optimal care. Again, we're capturing real-time details. So looking at when you're asking them, so with this LifeMap tool, you're asking them about their sugars, what time they wake up, what they eat, what their sugars are after that. But then we want to lay this framework about social determinants of health, trying to get a deeper dive into what could be impeding care. And when we're looking at these social determinants of health, we're starting with 45 buckets because I realize there's so many issues and there's so many questions that come up and that could be impeding care. And then using that data, we can actually look at what is happening and what is the barriers to care. And on the right, you'll notice a health promotion survey. So I work over at Erica Chandler Health Center in New Brunswick, and this was a very, very initial screen that we used in terms of creating this health promotion survey or screening for social determinants of health. We were looking to enroll patients who are from RWJ Barnabas affiliated diabetic clinics. And we're looking at this across like a system-wide approach. And although as much as I would love to do a big approach, I think we started looking at patients with diabetes and how to approach it from the LifeMap goals. And how can we capture the information that we get from these tools by looking at the questions that we're generating. So when we're talking about these buckets, we're asking about foods. That's one bucket. And we're talking about food insecurity specifically. So we're asking the question, do you have enough food for you and your family? So if it's yes, that's it. Question's over. If not, would you like help? Do you need food tonight? So is it an immediate emergency? Would you like help with this? Yes. If yes, do you need food for tonight? So connecting them to emergency services versus long-term services, and sending that prompt that your physician or healthcare provider will help with these resources if it's ever needed. So understanding why we're asking those questions. How will these findings be used? And I'd like to actually turn it over to Dr. Bleich, if you don't mind talking about the work that already has been done around LifeMap.
The implications of this are huge, because being able to capture this information, we can move it in so many different directions. I mean, we just highlighted a few of the things that we will be able to do, presenting at national conferences, obviously publishing in peer-reviewed journals, and then working with other colleagues in the School of Pharmacy, someone like Laura Peasy, who has an expertise in health econometrics.
Okay, so thank you, Dr. Blake and Dr. Pai, for the great presentation. Are there any clarifying questions that anyone would like to ask about the presentation or anything in particular?
This is Jeannie Ferrante. I just have some questions about the platform. How many people are already using it currently?
It is being used. There's a primary care. We've probably enrolled a couple of hundred patients onto it already. Yes, so it's functional.
How can machine learning and artificial intelligence be incorporated into this project?
So the main task that everything in machine learning is doing today is to categorize something where the categories are known. So you have many instances, you have a few categories, you as a human can pretty clearly say, this is a tiger, no, this is a lion. And then you train a model so that it can duplicate the human achievement. And this has gotten much, much better in the last 5 years because of two reasons. One of them is that our computing power has exploded. And the other one is that our available data has exploded. If the categories that we want to learn are clearly known, then machine learning can be successful. But if we are still struggling to actually define what the categories are, then it's somewhat less so.
Are there people or groups at NJIT that might make sense for this group to connect with?
We have 3 people that immediately come to mind that are working in machine learning with some medical slant. One of them very successfully working with a group in Philadelphia, and they're getting major funding. So yes, we do have expertise in my department for this, and not just expertise, but also interest in the medical side of it.
How can we partner with existing cloud-based platforms already incorporated with our healthcare system to screen for social determinants of health?
NowPal is the obvious answer. So what we're doing is we have a set of SDOH questions. It's then being fed into NowPal to create this Healthy RX, a personalized list of local resources based off of that person's zip code. And then it's sent out to them and then reattached to that patient's chart. So if you're looking for the resource side of it, that's a cloud-based solution.
Rachel, how many individual lives do you have that are being navigated through NowPal?
So the goal is 100,000 over the next year.
Where
and we have room. we're just starting the pilot, so that's our capacity.
So do you see a space about how this could, like LifeMap could be, incorporate a piece of this? Because
our goal is to screen our patients and connect them to resources. So it seems like we're in line with what we're doing.
So partnering with someone like NowPal in the community, we're already on the same page. How can we do this so we're not, reinventing the wheel, but we're collaborating together?
So NowPal is integrated into Epic. And so those results are feeding in, whether the provider is on Epic currently or into 2025, their results will be there when they come on. So, I think you just need a connection from LifeMaps to NowPal, and then it will all feed.
I agree. And that's exactly what we could use that help with that connection.
The other thing I want to point out is somebody mentioned before that everybody has a smartphone. Not everybody has a smartphone, and especially the most vulnerable populations where the social determinants of health, really impact their health outcomes and their lifestyles and their access to healthcare. So I don't know if you want to think about, for people without a smartphone, can this be used, And
I think another population we're losing are people who are illiterate as well.
Right.
So I think that's, those are two. I think that's a very important point.
And I think this is a great segue into the last question. Will patients be receptive to smartphone technology?
I guess you'll have to decide on how burdensome is it for the patients. Are they going to be answering these questions once, or they're going to be answering it daily or weekly, right? So I finished a study with African American breast cancer survivors where we used smartphones and used Fitbits and wanted them to log in, their meals and stuff like that. And the people who did it, they did great, but people ended up, not really adhering to the daily tracking of food, that kind of stuff. So that's something to think about to make it more acceptable to patients, is to make it not burdensome.
So I guess my question to this group was also, so our next steps. So how do we move this forward? I feel like the people here have been like given us fabulous feedback. So I look at Dr. Geller, who could give us that artificial intelligence information, Rachel, who's already been doing the work already and incorporating that, and then Jeannie for her expertise. But again, I know everyone's super busy and I don't want to burden them, but I think, I think we're fortunate to have like some of the key stakeholders right in front of us right now.
So part of what we wanted to do today was to introduce the group and at least sort of do a warm handoff so that you get a chance to talk about your project, people sort of know who you are, and then as you're sort of moving forward, that's really the purpose of this. So we're happy to have facilitated that. And if you can think of, if there are others, like as you're sort of meeting and thinking about this and shaping it along the way, if there are other questions or other groups that you want us to sort of reach out to, we'd be happy to do that.